Hey, Gloria, we are excited to have you. And I'm so excited because number one, that you are the first Tanzanian to be on the show. So you'll introduce yourself and kindly waambie wa Tanzania wa subscribe. So introduce and then waambie wa Tanzania wa watch hii kipindi.
Thank you so much, Gladys, for having me. Yeah, I'm so glad to join you today. Yeah, as you said, I'm Tanzanian, and I will tell them to join. Please join this session. Tafadhali sana jiungeni na msikilize Gladys. She has the amazing stuff that she can share with you.
Mm-hmm. So asante sana, asante for creating time. I was stalking your LinkedIn and oh goodness, I'm so inspired. Kwanza, you are a medical doctor with extensive research experience. You studied at UCL, you studied for your master's at UCL and then your PhD at Oxford. And I know you're doing amazing things now. I know you were based in Kenya at some point. So I'm excited for us to go through all that. But can we start from why medicine? Like, what got you into medicine? I don't think actually you are the first medical doctor on the show. So tell us about what inspired you into studying medicine. Where did you study medicine? How was it? I hear it's rigorous.
Yeah, that's very true. Actually, that's a very good question. So when I was in secondary school, I think we use secondary school. I don't know if you use secondary school in Kenya. That is after finishing primary school. When I was in secondary school, they used to consider people who were doing well in science as like future engineers and doctors. So they were like encouraging us to do mathematics, biology, chemistry, and physics. And I remember even when I was doing these subjects and I was passing them very well, I didn't really know what I wanted to do after I finished secondary school to go to high school, which I think we don't have in Kenya. And I think at that time, my brother was in medical school. My second brother is a doctor. And so I remember like trying to like understand what he was doing. And also there was another cousin that I knew was in med school. So they really inspired me to consider medicine. Although actually I used to perform more in mathematics than in biology. So I knew someone who was like already, or people were already in medical school who were doing well. And they really inspired me to take medicine. But I think thinking about it, maybe if I had other people that I knew who did well in engineering or other medical or science subjects, or maybe fields in university, maybe they would inspire me to do other things. But mainly from seeing my brother doing medicine, how I was inspired also to do medicine after I finished high school. So in Tanzania, after secondary school, you are supposed to choose 3 major subjects in high school, and those will determine what you do in university. So I chose biology, chemistry, and physics, which if you choose that route, you can't change after finishing high school. So there was no going back. And so after that, it's either, I think with that combination, you could do medicine, you could do pharmacy, any other like medical sciences, but you can't do anything else beyond that. So yeah, it's my brother who said.
All right, so it was mostly influence from your and it's interesting that you decide that quite early, because I don't know, you made that decision when you were around 15 years, right?
Yeah, and I think it's also, I would say, challenging and also interesting at the same time, because I speak to other people from other countries who can do all subjects until high school, then they choose what to do when they go to university. And that's not the case in Tanzania. You have to decide, actually, I think when you're in Form 2, which is like the second year in secondary school, whether you want to continue with science subjects, or you can choose business subjects, or just drop all these other subjects and remain with what they call art subjects, like civics and history and languages. And so, yeah, at that point, I actually agree that maybe if you had people who are coming to school to talk about their careers, some of the options that we could have after finishing secondary school, maybe I'll choose other things because I did business, for example, the first 2 years of secondary school. And I remember loving commerce and bookkeeping so much. I used to do so well in those subjects. But it's just because I knew people were doing medical stuff. Like my brother was there studying to be a doctor. So yeah, it inspired me to also do that.
Okay, that is interesting. I think in Kenya we, because personally I decided what I wanted to do after high school. Although I know some subjects, if you didn't take some subjects, maybe they would then limit what you do in campus. But I feel like with the current education system that we call 844 in Kenya, it was quite flexible in that way that you can still do, you're still very flexible to do whatever in uni. But then there is a new curriculum. Is it curriculum? New system, new education system coming in called CBC in Kenya, and I think students would be required to make that decision quite early. So yeah, I don't know what I imagine. Each system has its own pros and cons, so I don't know which would be
Yeah,
considered the best.
I agree. I agree. And I think I remember thinking when I was deciding what to do, I could see myself being a doctor, but maybe at that point, I couldn't see myself being an engineer. I never saw anyone as an engineer at that point. So, yeah, for some reason, that can influence what people choose to do.
Mm,
Yeah, which is a shame.
mm,
And I think at that point, we're young, we're like 14, 15. It's yeah, quite early to choose what you choose can actually affect the entire career or your choices future in life. Yeah.
mhm. Okay. Yeah, and before we go to, I'm curious to know how your undergraduate was. But then tell us, where did you grow up? Which part of Tanzania?
So I grew up in Arusha. My parents were based in Arusha, which is the is northeastern part of Tanzania, near Kilimanjaro, near where Mount Kilimanjaro is, and also Mount Meru is in Arusha, and most national parks like back then Serengeti was part of Arusha, but now I think it's part of another region. But also Arusha National Park, Ngorongoro Crater, and all these amazing places where you can visit are based in Arusha. So I grew up there, but I did my like secondary education in other regions because we had to go to boarding schools. Back then, it was very common for people to go to boarding schools because there are not many night schools, maybe in Arusha. I think things have changed now. So yeah, I spent some years away from my family. But I think both my parents were well educated. So I think my story might not be similar to stories of many people who grew up in Tanzania. So my father studied in the US, my mom studied in the UK. And so I knew like people could actually study and go to university, could go abroad and all that. So I knew that from the time I was a child because I was hearing stories about all these places, but not necessarily that it's easy to do it. And yeah, so I have 5 brothers and 1 sister, and I'm the sixth born.
All right. Oh, nice, nice, nice. And it's good that you've mentioned about the influence of your parents, because I think I was going to ask that question later. That how did you know about the opportunities to go to the UK? Because personally, when after clearing undergraduate, I did not know that people went outside Kenya to study. I knew people went outside Kenya, but I thought they were like special kind of people. I did not know that you can apply for scholarship and get admission to universities abroad, etc. So thanks for volunteering that. But let's go back to undergraduate. I'm curious to know, how was, is it 6 years of medicine? How was it?
Yes,
Did you enjoy the rigor of medical school?
it was 5 years and the last year, and one more year for internship. So maybe you can call that also the 6th year. And yeah, I would say medical school was maybe the hardest for me. Like if I look back, I think those were the hardest years in my life because, as I told you, I was mainly in boarding schools, and I think moving from like smaller towns to a big city like Dar es Salaam, everything changed. including like the environment, like how they're approaching also teaching and all that. Everything was like not as we were not as pampered as I was pampered in secondary school. Like, it was too much to learn within a very short period, and also to just understand the environment. And the marking scheme was also a bit tough. We even had some subjects with penalties. If you don't get something right, they give you like negative marks for that. So it was really hard. I found it really hard. And I think because I was also adjusting the environment and other things. So I also didn't even have the best performance in med school. I have really average grades from med school, to be honest. So you can't say that, oh, maybe she did so well, that's why she was able to go to do her master's and PhD abroad. No, I had like just a basic certificate. But I think what also helped is like I also did a lot of extracurricular activities. I joined like some what we call like societies, and also I was doing things outside school, like to maybe to engage young people. That really helps to also put on your CV that you're not just doing this maybe classwork, you're also doing other things outside that. And I remember in my fourth year in med school, that's how I started like the journey of looking for like scholarships. Because for med school, in back then, I don't know how things are now, is like people who were selected to go to my university's name is Muhimbili, University of Health and Allied Sciences, is where the National Hospital also is. And so people who were admitted there automatically got the government scholarship to study there for free. I think we were supposed to pay part of the meals and accommodation, but we didn't pay school fees. And so I didn't really struggle to get scholarships to go to med school. And I think they're doing that to encourage people to go to science, to do science subjects in university. But in my fourth year, there was this opportunity to go to the US. There's a university called Dartmouth College, and they had collaboration with Muhimbili University, and they allowed 2 students to go there to rotate in some departments, but also to do their research there, so to collect data in the US. And they wanted people to submit your proposal, only 2 people in like every other year. 2 people submit your proposal and like your CV to say why you want to go to the US. And I remember thinking, so I had really good friends, including some friends who were like a year ahead of me or 2 years ahead of me, who encouraged me to apply. So I really am thankful that they actually encouraged me to apply, because I didn't think like I could actually apply and do all these things. And I also because I wasn't like the best student in the university or in my class to say, oh, maybe I have this nice GPA, I can go. But I think they encouraged me to apply. And I remember going to the head of back then head of this surgery department to explain to him what I wanted to do, my proposal, like setting up the appointment to talk to him. And I was like, oh my God, how can I dare to do this? So I remember explaining that to him and writing that proposal and submitting my CV and everything. And I was selected to do it. So I spent some time in the US. So I think that actually really helped me to see that, it's actually possible to do this thing from nowhere. If you make an effort to do something, you never know what will happen. So I said, rather than saying, I'm not doing it. So I actually did it. And I got to come to the US for a few months, actually, a few months when we were in our 4th year. And actually that really helped to understand, to be exposed actually to how things are here. Also the hospitals, how different they are from like hospitals in Tanzania. So it's when I started to have this interest in like global health, international policy and research. And so that's the summary of how the med school was.
And if you were to encourage a student So in Kenya currently, we just the other day they released the secondary education exams, end of high school, end of Form 4. We call it Form 4. So end of high school, and this is the time now when the students are deciding what they want to do in uni. And I know there will be so many of them who will decide to do medicine. What is one piece of advice you would give such students who are thinking of going the medical route to help them, I don't know, thrive, adjust to the medical career or medical school, and maximize the opportunities available there? What would be one piece of advice, or less, or something you wish we had been told, or you wish we had known before joining the medical school?
I wish I'd known that medicine is very hard and you have to be serious from day one, because if you're not, it's very hard to catch up. But also to do other things outside school. Maybe try to understand also like what different departments are doing, and try to engage yourself with other students in like different societies, because that can really help you to build your CV. It's not just what you are learning in hospitals or in your classes. If beyond that, that can really help to also get like job opportunities during your time in med school, but even after. But number one advice would be to prioritize school. It's not easy, but it's doable. And also, never give up. You might fail some exams, but just repeat them, continue if possible. I mean, many people have not done so well in med school, but they are great doctors. So never give up, even when you think like you're not doing as well as you hope.
Okay. Thank you for that. Now tell us about why did you choose UK, UCL, and what did you study at UCL? We're doing your master's over there.
Thank you. Actually, I did not choose just UCL. I was thinking of doing a master's in like international development, public health, or policy evaluation of programs in the health sector or healthcare. And UCL was not the only university I was considering, but maybe I was considering universities outside Tanzania to get that exposure, to see if I could learn something different from what I learned in medical school. And I think I was considering universities in the US because I was already in the US, as I told you, in my fourth year. So I thought like, I've actually seen how things are here. It would be a nice way to learn new ideas, experiences, maybe also to learn from students who be coming from different countries. So I was considering the US. And I remember writing to the then Vice Chancellor of the university. So I know, it's just the audacity of writing. So I wrote to him to say, can you tell me in case there's any opportunity to do like this kind of masters? I would be very grateful. And I know like back then, like you used to be scared of such people. So I said, no, if I could, because before I contacted the head of surgery to ask if he could be my supervisor for the US project, and I was like, this time I'm writing to the Vice Chancellor. And I think he wrote to me and said he didn't have any opportunities, so he will let me know, but he can't promise anything. Then I think that time I had just finished med school, so I was doing my internship. Then he wrote back to me and said, there's an opportunity to do a master's at UCL. It's Masters in Global Health and Development. I had never heard of it. And he also said this master's comes with a scholarship, so you should apply. And I think universities in the UK were supplying, or they're sending all these kind of ads or notifications to other universities in Africa to encourage people to apply. And so he forwarded that to me. And if he hadn't forwarded that to me, I would never know about this program and this scholarship as well. And so I said, thank you so much. I'm going to look into it. And
I went to the website. I started to learn about the university, how nice the university is, and also that scholarship, the scholarship he told me about. But also I saw other scholarships. And so I started to apply. I remember when I was applying back then, I think now I know so many people were like Commonwealth scholars, Chipman scholars, and yeah, so many scholarships, and people who you can actually go to and ask them, how did you write this essay? How did you do this? And I remember thinking, I don't know anyone who had gone to UCL who is Tanzanian that I can ask. So I went to Google and typed like who Tanzanian at UCL and everything, who has done this course. And like one person came. So I really searched and I found like one person called Donat, who is still my friend. And I emailed him and said, I want to do this course, please. And he responded to say, how did you even get my email? I said, I Googled you and I saw you went to this university. Then I Googled your name many times until I found your email address somewhere. That's how I contacted you. And he was like, oh my God, you're so persistent. So yeah, he guided me and that's how I applied.
And yeah, so I got into UCL, but I had an admission and I didn't have any scholarship. I didn't know actually there were like the deadlines for scholarships. So the time I was applying, the deadline for that year's scholarship had closed. So the good thing is like the course director advised me to apply the following year. So I deferred my admission or my offer letter until the following year. So that's the time I started looking for scholarships. So I started reading into like the Commonwealth scholarship, evening scholarship, and other scholarships. And also I remember that time I didn't know anyone who had gotten that scholarship. So it was just, I was responding to the application questions like blindly, but I was like, there's no way I'm giving up. I already have this admission, I have to apply. So I applied and I got the Commonwealth scholarship. That's how I got into UCL and did my master's in global health and development.
Wow, I love the persistence that you're already showing in this journey of yours. And how was it at UCL? How was the program? Was it a 1-year master's program?
It was a 1-year master's program, and I liked it because it had people from all over the world. Like Africa, we were from Kenya, Uganda, Nigeria, Cameroon, everywhere. The same applies to Asia, Europe, America. So it was really nice to learn from like all these people. And also it was very diverse in terms of like what they are teaching. They're not just teaching the core module, they're also catering it or tailoring it according to what people wanted to do in the future. So if you want to do law, maybe law in health, they had some modules for that. If you want to do nutrition in health, they had modules for that. Maybe conflict in health. So it was really, really nice, really eye-opening. And I'm so glad I took that course. I learned a lot from it. I learned what I'm still using now and what I used in my PhD.
Do you have was it challenging? Was it rigorous or challenging at all? How did you survive and thrive while doing it?
It was challenging. It was very intense. I think people who have done their masters in the UK will tell you, because that's supposed to be like a 2-year program, but they do it in a year. So from day one, it's like lectures from morning, from like 9 to 5. Then we also had what they call like seminars after lectures, like you go and discuss topics. And it's that like that every day. Then they give you some material to read at home before the following section. So it was very intense, but I enjoyed it, and I think I was very serious because I think so. You remember how I told you I didn't do well in med school, and when I was applying, because I was not sure I'll get in with my mediocre grade, I did the GRE exam, the graduate record exam, to just boost my grade. And I remember when I was applying for my master's, I swore, I said to God, like, if you let me get this degree or this admission in the scholarship, I am going to do my best. I'm going to do my very best. So I was very serious in that master's. I didn't like waste time. And also I knew I wanted to have like I would say, okay, maybe I didn't do well in school, but this is the last time in my life I am having this kind of grade. I don't want to see this in my life again. So I was like, I have to get like a distinction or something. So yeah, I was very serious, and I didn't have any challenges because of that.
How did you now find yourself at the University of Oxford? Because I know you went there to do your doctorate, and you will tell us about your, I think it was at Oxford, that is when you were telling me you were at Kemri in Kenya at some point, researching something to do with newborns, babies. Tell us your journey to Oxford, and what were you researching?
So my journey might be different from other people's because I didn't go to Oxford straight from UCL, from my master's at UCL. I didn't do that. I worked for 4 years. So I went to Oxford after working. So I wonder if you want me to tell you about Oxford or to tell you about my work before.
Wait, tell me about the work. Yeah, did you go back to like a hospital to practice as a doctor, or were you doing research?
Yes. So after UCL, when I was just finishing the program, I lastly started to apply for jobs because I knew that I wanted to do like more of like research and policy work. And I think I told you I was applying for all these opportunities when I was an intern. So I was doing more of the hospital work, clinical work, working in a government hospital, seeing patients. I enjoyed that, but I knew I would also like to do more of like the policy work, programming, to understand how do you actually make the health system work. And so I was applying for jobs. And so as soon as I finished my master's, I got a job with the UK government under the Department for International Development, or DFID, which doesn't exist anymore. They merged with another department and it's now called FCD, or Foreign Commonwealth Development Office. So I was based at the British Embassy or High Commission in Dar es Salaam. And I was overseeing their nutrition and health portfolio. So they're investing in reproductive, maternal, and newborn child health, things to do with making sure there's availability of commodities, supply chain, and contraceptives for women, nutrition for babies, but also they had other portfolio in like things like HIV and immunization. And so I was overseeing that portfolio in Tanzania. But also it was an interesting job because I also got a chance to visit like other countries to do like short-term assignments. So for example, I spent about a year like doing like back and forth in Rwanda and also Burundi on the Ebola preparedness. Back then there was an active Ebola outbreak in DRC Congo. And so I was helping the embassies like in Rwanda to strategize how to help or to prevent the spread into Rwanda. I was able to like work in Sierra Leone on the recovery project for health after the Ebola outbreak, or I don't know if you can call it pandemic, in Sierra Leone. And I also spent some time in Nepal and like to help to like evaluate the program. So I really had a great time working for those 4 years. And I think that experience, like international development experience, policy, programming, financing, really encouraged me to like do my PhD to understand more how global health policies and research look like, to also be an independent researcher and an independent thinker. That's what also pushed me to apply for a PhD. So when I knew I was applying to do a PhD, I actually didn't just target Oxford because I know it's competitive. Like this field is competitive. So I had like an Excel sheet because now I feel like now I understand how things work after applying for another scholarship. So I know now, because before I didn't know about the deadline and where to look for these opportunities. But then I knew when I was doing my PhD application. So I had an Excel sheet where I had like a list of universities I was considering, who are the potential advisors or supervisors, their deadlines and requirements and everything. So Oxford was like one of other universities I was considering, because also Oxford, my department has researchers who have worked in low middle income countries for years, over 20 years. So I thought that they would be like the best people to advise me. But they also have other nice universities, like UCL has people from who have worked in Africa. London School of Hygiene also has many experienced researchers. And so I actually prioritize the UK because firstly, I thought of the US, but I thought it would be like a longer PhD, given that I already had a master's. So I didn't feel like I wanted to do these like basic modules, like methodology and stuff, because I already had a master's. And I think I was just biased because I did my master's in the UK and I worked with the UK government and I had so many trips back to the UK. I had many friends in the UK. So somehow that embarrassed me. I didn't consider the European or countries or Australia. And so actually, it just happened when I was applying. Oxford had like my department. I was considering my own projects, but also projects which are already advertised by researchers, which align with what I wanted to do, like global health, the method, like qualitative method, but also the areas like innovation in global health and things like that. So I was considering both, and so this opportunity came, and my friend Melvin shared it with me, and I saw it on the website, and so I applied. Although I knew, like, oh my God, I'm applying to Oxford. But I was like, I better apply. I better send my application to Oxford, Cambridge, all these best universities, so that if I don't get in, if I get another university, I'll tell myself, I send my applications there, but I didn't get it. Rather than think, oh, what if if I had sent my application, then maybe I would have been admitted. And I think this is because of the conversation I had with the same friend Melvin. I think you know Melvin, he's Kenyan. When Melvin also did my master's, the master's I did at UCL, he was my classmate. And I remember when we finished the master's, when I was about to leave, we had this conversation. We asked ourselves, why did we not send our applications to Cambridge or Oxford? And we're just laughing about that. And yeah, surprisingly, or maybe it's great that Melvin got into Oxford in 2019. I mean, like 2 years before me, Melvin got into Oxford. And I think when he told me he got into Oxford, I was like, oh, this was our discussion. Like, why did we not send our master's applications to Oxford? And so I was like, oh, this is great. And so he got into Oxford. Then, he sent me this application. I also got into Oxford. And we had another friend also who visited us, who also went to the same course. And 2 years later, he visited us at Oxford and said, oh, I'm also going to apply. And she applied and she got into Oxford. So I was like, wow, this is great. And actually, I should mention that when I applied to get into Oxford, I was very lucky that my PhD was already funded through a project. So the National Institute of Health and Care Research, NIHR, which is like part of the UK, it's an institution in the UK, and it's getting funding from the UK government to support research and international development. Yeah, they've supported my PhD, so I'm very grateful. So I didn't have to worry about anything. And so part of this project was to do research because they're already doing research in Kenya, as I mentioned, in Africa. So for this particular project, they already had like established relationships with researchers in Kenya. So it made sense for when choosing which countries to go to for data collection. We as researchers under that program prioritized Kenya because it was easy for getting research permits, easier for research permits, and establishing relationships which are already there, you already know people. And also, it's also to acknowledge that PhDs have like a limited time. So it might take longer to go to like a new country or to establish these relationships with new people. That's why my supervisors um, somehow advised, or they were also based in Kenya. Yeah. And so it was a very rewarding experience because I got time to think on my own, and it's for the first time I wasn't just responding to emails day and night. I had like time to think, time to come up with my ideas, to share them with my supervisors, and also to be able to write, to collect data in a new country. So I think that was amazing because as Tanzanians being in Kenya, I mean, it was nice to see like it's the same language. It's most things were similar to like what we do in Tanzania, but it was interesting to see how hospitals collecting data in hospitals, to see how hospitals are different or similar to like hospitals in Tanzania, to establish like relationships with new researchers, and to learn the culture there. So, and also to see that actually I could work in another country and do the work just fine. So that's actually very rewarding to see, also to demonstrate in the future that I adapt very fast. I can study the culture. I can be mindful of the culture as well, and be able to come up with results without I don't want to say issues. I mean, to also overcome issues or challenges that come with that. And so I learned to be mindful of people around. It could be like other researchers, could be people involved in the data collection and all that. To also be resilient, to know that this is new, but you can do it. And we joined during the COVID pandemic, so I learned to take risks because I left my job to do a PhD, and that was my permanent job. I could decide to stay there until I'm 60 something, but I said no, I want to go. I'm leaving this permanent job to do a PhD. So I learned that, and I also learned to advocate for myself, to be able to say, this is the research I want to do, these are my objectives, this is what I want to achieve.
Amazing. What were you researching? You told me you're researching it because I loved
it. I answered everything except what I was researching. So
no worries.
And so what I was researching is, in a simple language, you know how there are so many innovations, so many technologies being rolled out in low middle income countries. It could be phones, could be small gadgets, anything. And most of them are actually being manufactured here or in Asia or outside, maybe even Africa or even within Africa. And they have been tested, they have been maybe certified, and maybe there's evidence to show that they work and they can help to improve lives, to improve how things are being done. But actually, there's not much that is known regarding what happens once these technologies, innovations are where they're supposed to be, or they are supplied there. Because the end usually is like, oh, we've given you this, bye-bye. So it's the same thing also in health. I was mostly interested in the technologies which are given to babies who are, not to babies, to health professionals, to help to improve health of babies who are born, newborn babies, and they're less than like a month old. And these technologies are supposed to help with maybe breathing, to help with feeding, to help with maybe testing to make sure that it's faster. But we don't really know how are they being implemented in these resource testing. And are we getting the results we want to see? Or are we getting the negative results? What is required in that context for these technologies to work? What are the things we need to consider? So I was mainly focusing on them. How are health professionals making these decisions to use these technologies or to use, and why? Why in that context? Like what? So the communication around that. And I I chose like two technologies. There's one called CPAP, which you can say in a simple language is like a ventilator for babies to help them breathe. And there's another technology called phototherapy, which is helping babies who usually are born with what we call jaundice. It's like a yellow discoloration. And if it's gone untreated, it can cause even brain damage. So I was trying to understand how they are being implemented in hospitals in Kenya and how such professionals interact with them. And so some of the things, or the main things that I found is like we have to consider the context. And that's the message that actually we are not seeing, we are not getting from the existing evidence. Or it's there, but it's not comprehensive. So the physical context, for example, introducing this technology in hospitals is already very contested. There's already a lot of that is happening. Many health professionals, many managers in the health newborn, how do you expect them to communicate to make these decisions? The environment is very contested. There's the physical context. What about the organizational context? Things to do with how do people make decisions? How is the organization? Their teamwork? Is there like some hierarchy? All this can say, because if someone high level saying you can't use this technology or you can't be the one to decide, they have to wait for someone senior. There's no way they will be able to use it all the time because senior people don't come to the ward or to the hospital wards all the time. What about things like accountability? How are we making them accountable, compliant to make sure that their guidelines go with what we want them to do? Things to do with how do we appreciate those professionals when they use or do not use this technology? The use of data that is coming from using this. Is the data showing improvement or not? And things to do, another area that I found is like things to do with the technology itself. Because I think sometimes we don't really pay attention to how complex maybe that technology can be. So maybe this kind of a phone might be different from the other kind. So how is the phone itself, the features of that technology? Is it noisy? Is it hard to connect? Because many tubes, like the CPAP, the ventilator for babies, the CPAP I told you about, you have to put it in their lungs. Maybe people don't like it, they find it like invasive, hard to connect. You have to have many tubes and all that. How it functions is noisy, and all these things can really inform whether health professionals want to use them or not, and all that, how it breaks down or it doesn't break down frequently, maintenance and repair, and funding for that, making sure there's sustainability. And so that's what I was researching. But my focus was not just for those two, it was just to inform all other innovations, to say not just to donors, to government and other implementers, like you are introducing this, but actually the work doesn't stop there. After you have supplied this number of these machines in the hospital, you have to consider all these contextual factors, physical, the technology itself, the wider system as well, referral system, does it increase the workload and stuff? And things to do with their relationship with other partners. And also, it's very relevant, I think, I believe, because of also how now technology is going to be even bigger with AI and stuff. All these things are going to be introduced in hospitals, and we have to think of like, it can improve our performance, but are we considering other consequences? So that's my PhD all about, implementation time.
Amazing. And I know you've submitted and got your PhD sometime in 2024. So
thank you.
Congratulations on that. Congratulations.